Mr. Chairman, ladies and gentlemen, I am honored to share with you some clinical cases. We have been treating with MFM in Clinique Cœur et Vaisseau at Rabat, capital of Morocco. Actually, as of this day, worldwide, 190 cases of thoracoabdominal aneurysm have treated by MFM. Our Moroccan cases, we have 9 thoracoabdominal aneurysm and 5 abdominal aneurysm. This is demographic data of all the patients. All the procedures have been done under local anesthetic, and we implant 32 MFM. The mean duration of the procedure is 1 hour, and the post-procedure stay 2 days. This table summarizes 9 thoracoabdominal aneurysm, and the second table, abdominal aortic aneurysm. Our results show technical success of 100%, and we implanted between 1 and 5 units of MFM. At 30-day outcome, we have no spinal cord ischemia, and all the branch remain patent. The exclusion of the aneurysmal sac can take several months. In the follow-up, we had 2 days not related stent, and we had also for 2 patients evolution of PAD leading to fem-fem bypass at 1 month and 4 months for each one. Let's review some clinical cases we have treated by MFM. And the first case is concern a woman, 16 years old, had a tuberculous aneurysm, and this is the MFM, this is the CT scan before the implementation of the MFM. On this slide, we can see a different level and a different level and a different time of the follow-up, the exclusion of the aneurysmal sac. And on the right, we have the volume study, and we can see the degrees of total volume, thrombus volume, and the lumen volume that join the MFM volume. This is the constructed images before and 18 months after the procedure. The second case concerns a patient who had back pain, and the CT scan revealed the thoracoabdominal aneurysm with vertebral erosion. We can see at 1 month the exclusion, the sac, the aneurysmal sac is almost completely excluded, and the patient note that the disappearance of the pain. This is the constructed images before the procedure and 1 year after. The third case, also thoracoabdominal aneurysm, and we can see exclusion of the aneurysm at 6 months. And the volume study showed the lumen volume joined the MFM volume. Comparing evolution of and between transversal diameter and anteroposterior diameter, we can see on the left the first box plot illustrates the difference of the distribution for transversal diameter between before the procedure and 1 month after. The second box plot show the same difference between 1 month and 6 months, and the third one, the same thing between the 6 months and 1 year. And on the when we on the right, we can see the same distribution for the anteroposterior diameter. And if for both transversal diameter and anteroposterior diameter, we can see the major reduction occur between the first procedure and 1 month for the two diameters. And in the median, the median of box plot, we can see that there is a slightly higher reduction were noted for anteroposterior diameter and then for transversal diameter. And in the second box plot, we can see that there is slightly higher reduction for anteroposterior diameter, and it's more than transversal diameter. Because here we see that we have less dispersion for transversal diameter. And the PELD test led us to conclude that we have the mean of difference in transversal diameter is 40.81 millimeter between the first procedure and 6 months. And you can see that the reduction of anteroposterior diameter is higher than transversal diameter, because we have the mean of difference of in 16 millimeter. And we have also treated the 5 abdominal aortic aneurysm. This is the first case. This is patient who complained by stabbing abdominal pain, and we placed a stent. And we can see at this slide the reduction of diameter of 60.6%, and the volume study showed the degrees of total volume and the thrombus volume. And this patient, we can note the disappearance of pain at 3 months. The second case is autobiliac aneurysm, and we placed 2 stents, one on the left autoiliac and the other in the right iliac artery. On this slide, we can see at the aortic level and the both iliac level, we can see the evolution of the exclusion of the aneurysmal sac, and this aneurysmal sac is completely excluded at 1 year. This patient had the juxtarenal aneurysm, and we can see the evolution of the aneurysmal sac between 1 month and 6 months. And this is reconstructed images where we have the same things, 1 month and 6 months. The last case concerned a patient who had a juxtarenal aneurysm, involved both hypogastric arteries, and at 4 months follow-up, we can see the SMA patency and both hypogastric arteries. All these cases show that multilayer flow modulator represent an alternative to current devices. We begin Moroccan registry, including 6 centers until 1st March, and I hope to present the results in the future. I have pleasure to announce our first medical congress of our Moroccan and Maghrebin Society, which will be held in Fez, in Morocco. And it's a great honor for us to have support by ISIS. Thank you for your attention.